Hello everyone, and now we are down to our learning activity number 4, which is entitled Decalcification of Calcified Tissues. Decalcification is an optional process. It is usually carried out between fixation and dehydration. Before we will discuss further about decalcification, so here are our learning objectives. First is to appreciate the significance of decalcification in processing tissue specimen, determine the factors that influence decalcification, enumerate the different agents of decalcification, value the advantages of each agent of decalcification, and identify the disadvantages of each agent of decalcification. Before we proceed with our discussion, I've got a question for you. Can you make thin sections from bones and teeth? The correct answer is no. Because these organs are calcified, you should remove the calcium first in order to make the organ soft for easy sectioning in the later process. Now let us define the word decalcification. Decalcification is the removal of calcium ions from a bone or calcified tissue through a histological process that makes them flexible and easier to cut. It must be done to bones, teeth, calcified tissues such as atherosclerotic plaque in blood vessels and tuberculous lungs. If not done, it can result to poor cutting of tissues and damages to the knife that is used in sectioning in the later process. The tissues such as the bone, teeth, atherosclerotic vessel, and tuberculous lungs are first cut into small pieces with a fine fret saw and trimmed with a razor blade to allow penetration of the decalcifying agent. There are two forms of pathologic calcification. When the deposition occurs locally in dying tissues, it is known as dystrophic calcification. It occurs despite normal serum levels of calcium and in the absence of derangements in calcium metabolism. In contrast, the deposition of calcium salts in otherwise normal tissues is known as metastatic calcification, and it almost always results from hypercalcemia secondary to some disturbance in calcium metabolism. Now let us proceed to the different decalcifying agents. Decalcification is affected by the following. First is the dissolution of calcium by a diluted mineral acid. And acids are the most commonly used decalcifying agents because they are stable, readily available, and inexpensive. The second one is the use of chelating agents. The most common chelating agent is EDTA with a pH of 7 or neutral. The function of EDTA is that it chelates calcium to form a soluble salt. There are two forms of our EDTA. The solid form, which is the versin, and the liquid form, which is the sequestrin. The third one is the removal of calcium by using a diluted mineral and along with ion exchange resin to keep the decalcifying fluid free of calcium. The fourth one is the electrolytic removal of calcium ions from the tissue by the use of electric current or the so-called electrophoresis. And the last one is the microwave oven decalcification, which is faster than the routine procedure. Now let us proceed with our strong acids. First, we have our nitric acid, which has a decalcification time of 12 to 24 hours. It is the most common and the fastest decalcifying agent. PERENYI'S fluid, it has a decalcification time of 2 to 7 days. It is used as a tissue softener and a decalcifying agent, and this is good for tissues with small calcium deposits. PHLOROGLUCIN-NITRIC acid has a decalcification time of 12 to 24 hours. It is the most rapid decalcifying agent, and it prevents excessive softening of the bones. Hydrochloric acid, it serves as a surface decalcification, and it is recommended for small pieces of bones and teeth. So, surface decalcification is defined as a method of dealing with small unexpected deposits of calcium that may be encountered with paraffin blocks. Placed face down the tissue block on a pad of cotton or gauze saturated with 10% of hydrochloric acid for 1 hour. Now let us go over into detail about nitric acid. In order to prepare nitric acid, you must have at least 10 ml of concentrated nitric acid mixed with 100 ml of distilled water. The advantages of using nitric acid as a decalcifying agent is that it is rapid in action, it produces minimum shrinkage, produces good nuclear staining, and it is recommended for urgent biopsy, needle, and small biopsy. But nitric acid also has its own disadvantages, such as prolonged decalcification, which may lead to tissue distortion, damaged tissue stainability, imparts a yellow color with nitrous acid, and strong acids tend to be more damaging to tissue antigens when you are gonna perform histochemical staining. Let's proceed to PERENYI'S fluid. In order to prepare your PERENYI'S fluid, you need 40 ml of a 10% nitric acid, 30 ml of 0.5% chromic acid, and 30 ml of our absolute ethanol. The advantages of PERENYI'S fluid are the following. It is recommended for thin purposes. It decalcifies and softens tissues at the same time. And the nuclear and cytoplasm staining is good. And lastly, maceration is avoided due to the presence of chromic acid and alcohol. Disadvantages of PERENYI'S fluid is it is a slow decalcifying agent for dense bones, and complete decalcification cannot be determined by chemical testing. Next, we have our PHLOROGLUCIN-NITRIC acid. In order to prepare this one, you need at least 10 ml of concentrated nitric acid, 1 gram of your phloroglycin, and 100 ml of our 10% nitric acid. Advantages of using phloroglycin-nitric acid. It is the most rapid decalcifying agent and it is recommended for urgent cases. As for the disadvantages, nuclear staining is poor. Prolonged decalcification produces extreme tissue distortion. Yellow color must be neutralized with 5% sodium sulfate and thoroughly washed with running tap water for 24 hours. Complete decalcification cannot be determined by chemical means. Hydrochloric acid is inferior as compared to nitric acid because of its slower action and greater distortion of tissue. It produces good nuclear staining, and 1% solution with 70% alcohol may be recommended for surface decalcification of tissue blocks. In order to prepare von EBNER'S fluid, you need the following: 50 ml of saturated aqueous solution of our sodium chloride, and we have 8 ml of 36% of our concentrated hydrochloric acid, and 50 ml of our distilled water. Advantages of using our von EBNER'S fluid. It permits good cytologic staining. It is moderately rapid decalcifying agent. It does not require washing and is recommended for teeth and small pieces of bone. And the disadvantage of using our von EBNER'S fluid is that the extent of decalcification cannot be measured by chemical test. And we are done with our strong acids as decalcifying agents. Now let us proceed to the various weak acids as a decalcifying agent. First, we have our formic acid, which has the advantages of using formic acid. So it can serve as a fixative and a decalcifying agent at the same time. It permits excellent to clear and cytoplasmic staining. It is recommended for small pieces of bones and teeth, and it is suitable for most routine surgical specimens. The disadvantage of using formic acid is that it is relatively slow, it is not suitable for urgent specimens, and it requires neutralization with 5% sodium sulfate. Next, we have our trichloroacetic acid or our TCA. So in order to prepare your TCA, you need 5 grams of trichloroacetic acid mixed with 95 ml of our 10%. Advantages of using our TCA: it permits good nuclear and cytoplasmic staining, and it does not require washing out. As for the disadvantages of using our TCA, it is a weak decalcifying agent, it is not used for dense tissues, and it is a very slow-acting decalcifying agent. It is not recommended for urgent examinations. As for the sulfurous acid is suitable only for minute pieces of bone. Next, we have the chromic acid. In order to prepare our chromic acid, we need 15 ml of chromic acid, 4 ml of osmium tetroxide, and 1 ml of 2% glacial acetic. Advantages of using our chromic acid is that it can serve as a fixative and a decalcifying agent, and it is used for decalcifying minute bone spicules. Disadvantages of using our chromic acid: the nuclear staining with hematoxylin is inhibited, and it tends to undergo reduction and forms precipitates at the bottom of the container. Insoluble pigments are formed when dehydrated with alcohol. The degree of decalcification cannot be measured by the routine chemical test. Next, we have our citric acid citrate buffer solution. How to prepare: you need 7% of aqueous solution citric acid in a monohydrate form, so at least 5 ml, and you're gonna mix it with 95 ml of 7.4% aqueous solution ammonium citrate, which is anhydrous, and lastly is 0.2 ml of 1% aqueous solution of our zinc sulfate. Some of the advantages of using our citric acid citrate buffer solution is that it permits excellent nuclear and cytoplasmic staining, and it does not produce cell or tissue distortion. The disadvantage of using our citric acid citrate buffer solution is that the action is too slow for routine purposes in the laboratory. And we are done with the discussion of our decalcifying agents. Now let us proceed to the various factors influencing the rate of decalcification. So the rate of decalcification can be influenced by several factors, such as concentration, in which for concentration and the volume of our decalcifying agent, so the recommended ratio of fluid to tissue volume for decalcification is 20:1. High concentrations and greater amount of fluid will increase the speed of the process. Now we have also fluid access. A fresh decalcifier should have ready access to all surfaces of the specimen, because it will enhance diffusion and penetration and facilitate solution, ionization, and removal of calcium. Next, we have the size and consistency. So increase in size and consistency of tissues will require longer periods for complete decalcification. The ideal time required for calcifying tissue is 24 to 48 hours. Dense bone tissues usually require up to 14 days or longer in order to complete the process. And next, we also have our agitation or mechanical agitation. Mechanical agitation and moving of the tissue in solution usually influences fluid exchange, accelerates the rate of diffusion, and speeds up the decalcification process. So gentle agitation may increase the rate of decalcification. It is achieved via low-speed rotation, racking, stirring, or bubbling air into the solution. And agitation can cause or slowly dislodge precipitates from the tissue. Lastly, we have temperature. For temperature, heat will serve to hasten decalcification, but it also increases the damaging effects of acids on tissue. Conversely, lower temperature decreases reaction rates. Therefore, the relationship between decalcification and temperature is directly proportional. There are several methods to check if the endpoint of decalcification has been reached. So first is the physical or mechanical test. So this is usually done by touching or bending the tissue with the fingers to determine the consistency of tissues. This is, however, a very vague and inaccurate way of determining if a tissue has been completely decalcified or not. Physical or mechanical test is also known as the flexibility method. The second one is the X-ray or the radiologic method. It is a very expensive, although the most ideal, the most sensitive, and most reliable method of determining the extent of decalcification due to its ability to detect even the smallest focus of calcium, which appears opaque in an X-ray plate. Examples of an X-ray or radiologic method, you can use your Kodak XO-mat or the Faxitron X-ray paper. Lastly, we have our chemical method or the calcium oxalate test. Calcium method or the calcium oxalate test, it uses your litmus paper and ammonium oxalate, this method is very simple, reliable, and convenient method which is recommended for routine purposes in order to detect the presence of calcium in the decalcifying solution. We also have the so-called tissue softener. It is used for unduly hard tissue that may damage the microtome knives. Examples of tissue softeners are the following. We have 4% aqueous phenol, which has a decalcification time of 3 hours. We also have our Muliflex, which has a soapy appearance. You can also use 2% hydrochloric acid, 1% hydrochloric acid in 70% alcohol, and lastly, the PERENYI'S fluid. And we also have the so-called post-decalcification, which is the removal of excess acid done by immersing the decalcified tissue in the following. First is the saturated lithium carbonate, and the second one is a 5 to 10% aqueous sodium bicarbonate. So the common practice of performing post-decalcification is that you have to rinse the decalcified specimens with running tap water. And these are the various histological products from a decalcified tissue. Before we will end with our discussion, I want you to remember the following. So more concentrated acid solutions decalcify bone more rapidly, but they are more harmful to the tissue. High concentrations and greater amount of fluid will increase the speed of the process. Heat will serve to hasten decalcification, but it also increases the damaging effects on the tissues. The rate of tissue and decalcifying agent, so the routine is 1:20. As for temperature, 18 to 30 degrees Celsius or room temperature is the optimum temperature for decalcification. 37 degrees Celsius, it can cause an impaired nuclear staining of Van Geyson stain for collagen fibers. And if you have a 55 degrees Celsius temperature, the tissues will undergo complete digestion within 24 to 48 hours. The ideal time required for decalcifying tissue is 24 to 48 hours. And dense bone tissue is usually required up to 14 days or longer in order to complete the process of decalcification. And as for reference, we have Histopathologic Techniques by Jocelyn Bruce Gregorios. And that ends our lesson for learning activity number 4, which is the calcification of calcified tissues. Thank you everyone and have a good day.